Now, back to anatomy. This is the classic example of what the anatomists show you and what cardiologists look at. If you look at this diagram, it's very pretty, but the critical point of the diagram is missing. The actual problem, where the problem occurs, is not on this diagram. You can argue the endothelium here is what we're going to talk about. That's the glycocalyx that lines the blood vessel system, but the actual vessels that are affected are not here. This example, I want to try to get a picture in your mind. The two ends here, this is coming into the heart. So we're the heart, we're the observer, we're the heart. This is the arterial system, and this is the venous system. This is what the conventional doctors look at here, where all the money is, surgery, angioplasty, all that stuff. The real action is down here, which we're going to get to as we go through this talk. Again, it's kind of another example, and the point of the example is the critical blood vessel that needs to be looked at is not on this diagram. Now, what we're going to talk about here is macrocirculatory disease versus microcirculatory disease. Because if you listen to a lot of these ads on TV today, and if you look at commercials today, almost all of them are either they're selling you a drug that's a miracle, or right after that, there's a law firm with an ad saying, if you had a problem with the drug, call 1-800, we'll take care of it. But if you listen carefully, a lot of the ads for blood pressure and diabetes medicines, you'll hear the announcer use the term macrocirculatory disease, macrovessel disease, which implies there's another circulation in the body, and that's the microcirculatory system. Now, this diagram here gets more to the essence of the problem. What the conventional folks look at is all this adventitial stuff out here, a large artery with the muscularis layer and the adventitia. But if you notice, the only vessel that goes through the entire circulation system is the endothelium. When it goes into capillary beds, it's just naked endothelium. There's nothing supporting it. So that's the only vessel that connects everything. All the other stuff is kind of an illusion in collective medicine's mind, where plaquing, cholesterol, this, everybody's got a theory, but all of it comes from this. So the key is this little vessel right here, the capillary. Now, this diagram gets more to the essence of the problem. Inside the wall of blood vessels are microvessels. And that's how the blood vessel gets its nutrients, blood supply, and oxygen. The endothelial lining doesn't allow things to cross into the muscle layer and the other layers inside of an artery. So the artery itself has a microcirculation in the cell wall, and that's how it gets what it needs to survive. And the microcirculation is the capillary, it is the endothelium, it is the glycocalyx. It is a biofilm that goes through the whole circulation, and it has function.